Further debate? I recognize the member for Waterloo.
Thank you very much, Mr. Speaker. It is indeed a pleasure to be here in Ontario's legislature for this afternoon debate on the fall economic statement. I do want to say it's a really interesting timing, personally, because this morning, I don't think hi, how are you? Good. I want to say I don't think that the goal around transparency around the financing of the province's expenditures, it has full transparency. And the reason that I say this is that earlier today in Scotia, the Finance Committee, we were supposed to be addressing the estimates for the Ministry of Finance. We're also supposed to be looking at the Ministry of Economic Development. We're also supposed to be looking at the Treasury Board, which is very interesting numbers. And we had lots of good questions. And of course, Mr. Speaker, you'll remember that this government has truncated, really streamlined, maybe modernized the estimates process, but in the end, you've reduced our time to do our job by a significant amount. We had actually had hoped to have at least, as in past years, 15 hours to actually explore the finances of this province. We have seen a fairly disturbing trend, I will say, of a lack of transparency about where the money is going. And on that point, this morning, which was in public session, the government called us, to this meeting, called the Deputy Minister and some staff from the Ministry of Financing, knowing full well, actually, that the government was not going to present the Minister of Finance or the parliamentary assistant, and that the accountability piece was actually not going to be happening. And I have to say, the getting sidelined like that as the finance critic and the Treasury Board critic is disrespectful to our democracy. And that sidelining actually has been a theme of this government. And I don't know who the one is behind the curtain pulling the strings and directing these measures. Somebody stand up. He's snapping at you. I have to say that today, this morning's process of that committee was incredibly disappointing, and we actually have no recourse. And I think that this is the important part, Madam Speaker, for those who are watching, which really includes my parents right now, is that we have no recourse because the government tabled the estimates at the last minute. And then, essentially, we left this place for 5 weeks because of a municipal election, which prevented us from actually having that financial oversight and that accountability on the proposed expenditures for the province of Ontario. So we normally would be able to question the minister, like, why is there so much money in the contingency fund? These contingency funds are very problematic. Why is there such a strong discrepancy between the Financial Accountability Officer's numbers and projections around revenue and expenditures versus the government's version of those finances? And this is really just an important part of our democracy. It's actually a really important part around accountability for the official opposition, for His Majesty's official opposition. And so really disappointed about that. The estimates will be deemed passed this Thursday. So we were supposed to be in committee all day today doing our work. We were supposed to be in committee all day tomorrow doing our work, as was, I believe, social policy. And how unfortunate it is that this government has denied us, not just us, because when you deny an MPP from doing their job or exercising their responsibilities, really, what you are doing is actually denying the people that we represent their due course, their due diligence, and their financial oversight. So, I mean, I had some strong words this morning in committee because I was completely unimpressed with the process. The government, pushed this all the way down to the line, to actually prevent us from being able to do this important work. And just in case people were curious, what are some of the questions that were going to be posed to the Minister of Finance? I mean, I think that it's worth mentioning a few of them, Madam Speaker, and one of them is really about the process, because what we have seen from this government, and the previous government was pretty bad at it as well, is that when they're designing a budget, and in this instance it would be the fall economic statement, when you're going through that process, who are you talking to? What questions are you asking? Who's at the table driving some of the decision-making? And who are you talking to and who you're not talking to? And so I want to say very clearly, based on the outcomes and this so-called prudent plan from the government, you weren't talking to doctors, and you certainly weren't talking to nurses. And we know how you feel about education workers, so they missed out in this fall economic statement. They missed out in a very big way. And when your process is flawed, then the end product is flawed. And so that's what we have here. We have a fall economic statement, which I think the people of this province were expecting a call to action, a recognition, if you will, about cost pressures, around inflationary pressures, around healthcare pressures, the concern around climate and around connectivity and education. Yes, education. It was so topical, of course, because of Bill 28, which the government had to repeal, because they had to at least recognize when private sector unions and public sector unions come together and say, this will not do. And quite honestly, I think the Labour Board, actually on Bill 28, was going to side on the part of those who were seeking a fair collective bargaining process, because this government has, to date, lost 14 court cases. So they are batting 100%, Madam Speaker. But I'm going to get back to that in just a second. But really, process does matter. And if you have the responsibility as the Minister of Finance, as the President of the Treasury Board, as the ministers of the Crown, who you talk to, who has your ear, obviously influences who's going to get the money. And there's some pretty interesting people who've benefited, Madam Speaker, through this process. It's interesting because even on Bill 23, the building more houses faster, you know who was not invited to that process? The Association of Municipalities of Ontario. So imagine this. Imagine the provincial government, the minister who says that housing is a priority and it needs to be accelerated, even though in the financial account, even in the fall economic statement, housing starts have been downgraded. So you've already admitted that that's a false narrative. The housing starts are downgraded for 2022, 2023, 2024. So you've already failed on the housing front even before you actually got started. And I would propose to the government that by excluding 444 municipalities from those conversations is part of the problem. So when the government finally took Bill 23 out in a very, selective consultation process, our critic on this has actually, I believe, moved some amendments to actually get more dates so that more people could articulate how concerned they are about housing, where the government is proposing housing, why the government is proposing, bulldozing over some of the green belt, why they're using immigration as a scapegoat to actually move forward this piece of legislation, which will not accomplish what the title of the bill says. I'm pretty sure this government has a dedicated staffer just to come up with names of bills that are very disconnected from the actual goal of the bill. I think working for workers, I mean, that was not about workers, let me tell you. This accelerated housing bill is, by their own admission, in their own document, not going to accomplish what the government has said it will. And when you even look at keeping kids in school. I mean, when they brought forward Bill 28, such an egregious piece of legislation that overrode charter rights, which actually had in the explanatory note, this legislation will pass despite human rights. I've never seen that before. Actually, parliamentarians across this country read that piece of legislation and they said, this is unprecedented. But even that bill was called keeping students in classrooms. And what happened on the Friday? Students were out of the classroom. So whoever is doing the titles for your legislation, I would highly recommend that they read the bill before they write the title. I mean, it's just a first small step, and obviously unsolicited advice. But the fact that you've excluded those 444 municipalities from the consultation on Bill 23 does not bode well, Madam Speaker, not at all. So if we had this opportunity at estimates this morning, I was going to draw attention to the two worlds that exist in this province. And I want to talk about the multi-year fiscal plan, which the Financial Accountability Officer and the Auditor General have also weighed in on. So the AG, and we like the auditor. I mean, she gives us a good reflection, an accurate reflection. She checks the numbers, and listen, we need that all the time in this place. The Financial Accountability Officer, his projections, he actually has an expenditure monitor. So that is our only way, Madam Speaker, especially when we are denied at Estimates and Finance Committee of doing our job. That monitor is really our only way of saying, okay, the government said they're going to spend, $1.5 billion. You heard $3.5 billion this morning. There's a lot of billions that get mentioned in this place. But really the only way that we can truly track the money in this place is through the Financial Accountability Officer. And I just want to remind folks, we fought for that position. That budget officer position was part of a minority government, the only minority government I've ever served in, back in 2013, and we insisted that that position come to this place because we knew that we needed another layer of financial accountability, really. And at that time, there was gas plants that were being cancelled and contracts being cancelled and billions going out through the Ministry of Finance and Treasury Board. And we really didn't have a good idea of how those decisions were being made. However, the FAO has given us that, but so has the auditor. Now, it is funny, not in a ha-ha kind of way, but how people really like the Auditor General's office when they're in opposition. When they get into government, you don't like her so much because she holds the government to account. Right? She checks the numbers. She looks at the promises that were made in the budgets, and she evaluates where that money went or where it didn't go. And listen, on the healthcare file, we need the accountability measures to be increased drastically. But the auditor had concluded that the 2022 Ontario budget was, especially around the provincial revenue from corporate tax for each of the 3 years, as well as contingency funds recorded in other program expenses for the 3-year period, appear to be overly cautious. So she has said to the government, and this is part of the narrative, is that we see the government, say that you don't have the money because you've parked it in these contingency funds, which is a fairly new practice. I mean, the Liberals are really good at losing money. These guys are pretty good at hiding money. Right now, $4.5 billion in contingency funds, when the Financial Accountability Officer and the Auditor General have said that the common practice for a responsible government, for a fiscally prudent government, is that you have maybe $1 billion in a contingency fund. And what's interesting is that the auditor believes that the following are underestimates. And so this is also part of this government's track record. You say you're going to spend the money, but then you don't. And so this would have been part of the accountability piece today in estimates. She had said, for the year ending March 31st, 2023, corporate tax revenue of $19.7 billion is understated by between $1.5 billion and $3.4 billion. Well, this matches up with the FAO, who has said this province is going to be running surpluses in 2022, 2023, 2024, all the way up to 2027 to $8.5 billion. So you have a government who has created a reason, because they're predicting that they're going to have $12.9 billion in deficit this year. I'll remind the members that are here in the House, and I'll remind the Finance Minister, that the revenue that is coming into this place because of high inflationary costs, because of personal tax revenues, because of corporate tax revenues, in the last quarter wiped out our operational deficit for the first time in the province's history. So because people are paying so much, because people are hurting in the province of Ontario, quite honestly, the revenues coming into Ontario's legislature have drastically increased. In fact, last quarter, we ended up, instead of having a $13.9 billion deficit, this province had a $2.1 billion surplus. It shocked everybody, to be fair. I mean, nobody predicted it. But what did the government do? They tacked it down onto the debt. So, Madam Speaker, when you have a surplus and you have a healthcare crisis and you've been through a pandemic where students in our education system lost the most classroom days out of any province across this country, and you say, you know what, we're not going to meet those needs. We're going to put this money over here to the debt because we're going to pretend that that crisis doesn't exist. I mean, that is an abdication of responsibility. And it isn't just about more money. It's about strategic investment into healthcare. It's about strategic investment into education. Instead of the shiny little baubles of $389 million with a $200 check, which will pay for maybe 2 hours of tutoring if you can get it. And listen, we've all seen the advertisement from the Ministry of Education for private tutorial services. So this does not wash with if you are looking at investments and if you look at a budget almost as a moral document, right, that indicates your priorities as a government. That's what a budget should do. It should tell the story of what you think is important. So this government, in the last quarter, with that $2.1 billion surplus, you said, you know what, the debt is more important than ICU capacity for children across the province at CHEO and sick kids, and the story that I told this morning from Waterloo Region of a child who was suffering from respiratory illness and was sent home because they didn't have the resources at the hospital, even though the hospital had said to them, in normal times, we would keep your child here, your 3-year-old son, we would keep him here to monitor him because that's in his best interest, but we don't have beds. So what I say to the Finance Minister, and I mean, obviously we see the way that the finances in this province are being distributed very, very differently. But had I been the Finance Minister, or if we had a say in actually where that money would go, that money would have gone into education, and it would have gone into hospitals, and it would have gone into health care. It would not have gone to the debt when you have CHEO at 138% capacity. These are choices. You know, these are choices. And to question the Minister of Health this morning and to get the sound bites and the talking points that do not reflect the reality of what's actually happening in this province is truly, well, I call it irresponsible, but there are other unparliamentary words that I could choose, but I'm being respectful of you as a new speaker. But when you look at what the Auditor General has said, the disconnect between the numbers that are projected here in the Fall Economic Statement and what she has said is that corporate tax revenue in 2023 could be between $1.5 billion and $3.4. Corporate tax revenue in 2024 could be between $1.9 billion and $3.9 billion. And for the year ending March 2025, corporate tax revenue between $2.1 billion and $4.2 billion. The government is creating a narrative that this is a time of austerity when they have money. Somebody said this to me. They sent me an email and they said, you know, paying down the debt to $2.1 billion when, you know, you have a healthcare crisis and you have a crisis around childcare and you have environmental degradation happening, when you have other choices, so it would be like you saying, oh, I'm going to pay down my mortgage, but I'm not going to feed my children or think about clothing or heating. It's a messed up priority, Madam Speaker, in these times, and especially with the cost of living. We have a 40-year high inflationary rate of 6.9%. The government clearly had not met with OCUFA or the faculty or students across this province, or maybe they just don't care. OSAP funding in the fall economic statement, by your own admission, is underspent. Which lends a very good question. I mean, I have students. I have the University of Waterloo, I have Wilfrid Laurier, and I have Conestoga College. I hear from students all the time, and they're trying to access financial aid. What's going on that the government has allocated, $990 million, and that is underspent? I mean, what's happening with that? That would be an opportunity at estimates to ask the Minister of Finance this question. And I just want to point out that the interest on OSAP loans is prime +1. So not only are students graduating into very precarious work and very, very precarious working conditions, but now they have this extra load of debt to carry with them. So just on this last piece around the multi-year fiscal plan, this is a direct quote from the auditor. When revenues are underestimated, the perception can be that the government has less funds available for decision-making than can be reasonably expected. And she demonstrated that the government underestimated corporate income tax revenue by $7.9 and $7.8 billion, respectively. The amount budgeted for the contingencies appears overly cautious. Given the nature of contingency funds, it is challenging to assess their reasonableness. And this has also been said by the Financial Accountability Officer. It is unprecedented, really, for a government to just have a pile of cash sitting over here and not have it allocated. I mean, and if the rationale is by the minister, the finance minister, that we're waiting for a rainy day, well, I would like to inform the government that it is raining. It is raining, it is storming, and people are hurting in this province. And you're benefiting from high inflationary costs from a personal tax perspective, from a corporate tax perspective. So more revenue is coming into this place, and you are not passing on the savings. You're not recognizing that high rent. We need proper rent control in the province of Ontario. You're not recognizing that heating bills continue to go up. You're not recognizing the potential of a strong conservation program for housing, which also creates jobs. You're not recognizing that food costs are going up and up and up, and people, more seniors and more students right now are using food banks than they ever have in the history of the province, Madam Speaker. Seniors are going to food banks. And has this government addressed the price gouging that's happening from the large corporate grocers?
You don't even mention it.
It's like it doesn't even exist. It's almost like what happens with the insurance. We're really going to ask the insurance industry to be kind to their drivers who aren't getting into accidents. I mean, it is lame, lame, lame. But why would the government? They tabled this budget 6 months ago prior to the election, and then when we came back, they tabled it again. They know that people are, really struggling, and the Financial Accountability Officer has said something really interesting on his October 27th report, where he does say that in this year we're projecting a $100 million surplus. So that number obviously does not jive with what the finance minister has said at $12.9 billion deficit. But he has said, and he was asked, why are you, as a budgetary officer, not saying that we're going to be in a recession? And he said, you know what? He goes, we're on a razor's edge in the province of Ontario. But there is obviously money there to address that. But he said it would take one more economic shock, like global lockdowns in Ontario. This would be the tipping point. So so the finance minister knows this. The president of the Treasury Board knows this, that if you want to prevent an economic downturn, a recession, and the Financial Accountability Officer says we're on a razor's edge, so we need to do everything to prevent a lockdown. Why wouldn't you invest in health care? Why wouldn't you invest in ventilation programs for our schools, for our classrooms? Those ventilation programs, those HVAC programs, not only are good for students, because obviously its goal is to try to keep students healthy, but it creates good local jobs. They can't be outsourced to China. They're very good local jobs. And so there's an accountability piece there around health and safety and also revenue. When you create more jobs, the province generates more revenue. It's like a win-win-win solution. And this government, do they acknowledge it in the fall economic statement? Even things have changed fairly drastically. Now, to listen to the health minister this morning, of course, she was like, we knew this was all going to happen and we had planned for it. We have chaos, Madam Speaker, absolute chaos. I mean, sometimes it feels like that is the playbook. You know? I mean, why else would you bring in a piece of legislation like Bill 28, which was never about kids in classrooms, because, of course, it was an epic failure. It was using the nuclear option of using the notwithstanding clause during collective bargaining. I mean, I don't know who came up with that idea. I still haven't figured out who the person is behind the curtain pulling the strings. But clearly, that was intended to start a fire. And I think at the end of the day, the government was surprised that they got so burned by it. But it did bring people together, I would say. So there are, you know, in estimates, there would have been obviously good questions around the autism file. I think its latest is 56,000 children waiting.
Was there a word?
What?
Was the word autism?
No. But I would have asked about it if I had a chance. And the mental health piece would have also been a key part where I would have questioned the government on why, given what we know, the latest data, particularly on child mental health, and how the pandemic and how isolation affected our youngest citizens, why some additional funding would not be allocated to mental health file. And I do want to thank the minister who's responsible for mental health, and I know that the member, what's your writing? Toronto St. Paul's. I know that the member for Toronto St. Paul's has also met with the minister to talk about eating disorders and all that entails, which is very complex. I recently met on behalf of Caitlin Roth and her family with the Minister of Mental Health, and we talked openly and honestly about where the money is going and where the money is not going. Madam Speaker. And I want to advocate for those additional community-based teams in Waterloo Region because we are historically underfunded. Nothing like what the member from Kiiwetinoong is facing, but significant nonetheless. So what I want to say about that is that, you know, the autism file in and of itself is pretty much a perfect example of a government that is not in touch with what's really happening in Ontario. And I have a lot of, for some reason, autism rates in Waterloo Region are very high, and the fact that we're losing time, that urgency, that sense of a critical time for a child's development, to miss that window, to have so many children waiting, and to definitely not see it reflected even as a priority in this piece of legislation is beyond disappointing. The overall piece, though, I think that was the most shocking for most Ontarians is on the healthcare file, because you actually have to actively be trying not to pay attention to what's happening in our hospitals. Maybe you don't watch the news, maybe you don't read the newspaper, maybe you don't talk to your family and friends about what's happening in our hospitals. But the government The government has certainly, when you compare the Fall Economic Statement to the Financial Accountability Office's Economic and Budget Report from October 27th, the government will be short approximately $6.2 billion in health, $1 billion in education, and $360 million in colleges and universities through 2024-2025. And the healthcare spending and planned increases fall far short of what is needed to address this crisis. So I guess I'll just go back to that FAO discussion, because the goal of having a financial accountability officer is to help the government. But I guess in some respects, the government would need to want to be helped, or would need to be receptive to looking at some additional information that is not in their own bubble, Madam Speaker, or in their own, fairy tale. The Ford government also stated in this document that they have added 11,700 healthcare workers since 2020, but we know that 47,000 new healthcare workers are needed to be hired per year for the next 3 years to maintain current service levels. So, and they're stubborn. There's a few other words to use, but they are stubbornly attached to this Bill 124. This is another example. You are going to lose this in court as well, I might add, but because overriding collective bargaining rights is an enshrined right for workers. But the impact of Bill 124 on the healthcare worker population cannot be denied. Last night I hosted a town hall in Waterloo on the privatization of healthcare, and we watched a couple movies around what has happened in Alberta and what has happened in Saskatchewan, and learned a lot about what's the formula for increasing privatization. And we instinctively know it, but one of the classic measures that was embraced by Ralph Klein and then Jason Kenney and that other guy Moe is that you essentially starve the system so badly that you revert and you create this narrative that the only way to save healthcare is by providing private services and outsourcing and contracting out the work that healthcare workers do. And the ground has been set for this exact thing. And double down on this the Fall Economic Statement, the mini-budget, because Bill 124 is wage suppression legislation. It has a demoralizing, disrespectful impact on the people who are working in our healthcare system, all the way down from the PSWs, all the way up to the medical professionals and analysts and diagnostics. And nurses, in particular, are leaving this province for other jurisdictions where they will be treated with respect. And you cannot open a new hospital that you're building or opening up a new bed that you have been talking about now for some time without the human resources, without the personnel. And this has been a consistent theme by this government, is that they do not acknowledge the value and importance of the people who are delivering public services. They say they do, but then they introduce legislation like Bill 28. They introduced legislation like Bill 124. The fact that you have not repealed this legislation yet aside from being stubborn, it's really irresponsible. It's incredibly irresponsible, Madam Speaker. And I know that you have nurses in your ridings. I know that you have people who have told you firsthand that they will be leaving the system because that 1% wage cap, when inflation is at 6.9%, but was as high as 8% earlier this year, is essentially a cut. So you can't call them heroes. You can't say you value these people who are right now down the street at Sick Kids Hospital. We heard from today from one of the doctors. They're resuscitating 3-4 children every single day. We heard that from Chio as well. Imagine the stress of that work. And then imagine having a government that says you're only worth 1%. The disconnect there is so evident to us, Madam Speaker. So I'd be interested to hear. No Conservative MPP has ever given me a good reason or a good rationale as to why Bill 124 is needed. And I will point out is that the evidence on paying people respectfully is very clear. In fact, David Card, who's a Canadian-American economist who won the 2021 Nobel Prize in Economics in recognition of his achievements and contributions to the field of labor economics, he and his colleague, Alan Kruger, refuted the conventional notion in labour economics that increases in minimum wage led to lower rates of employment in low-paying industries, because this has been part of the Conservative narrative for years. I can also say that it was part of the Liberal narrative for years too. And you know, you're going to hear some of the members tout that they're increasing the minimum wage. But I just want to go down memory lane just for a little bit on the minimum wage, because you know, when you look at how past governments have behaved, and then you look at how this current government is behaving on the minimum wage, it tells a very different story than these sound bites that we hear. But in Ontario, the minimum wage has bounced between being frozen and corrected. So 1997 to 2003, the minimum wage was at $6.85. Up to 2010, it increased from $6.85 to $10.25. From 2010 to 2014, it was frozen at $10.25. 4 years frozen. That was the compliments of the Liberals. But then from 2014 to 2017, it increased moderately from $11 to $11.60. They really went wild for that 3-year period. In 2018, Premier Wynne then announced overnight that it was going to go from $11.60 to $14 in 2018. And then this was followed by a $15 minimum wage if re-elected in 2019. Well, that did not happen, obviously. But one of the first things that the Ford government did when they got elected was they cancelled the $15 increase, and the wage remained at $14 until 2020, when it jumped slightly to $14.25 and then $14.35 in 2021, and finally $15 on January 1st, 2022. So when they tell you how generous they've been, it warrants a little history lesson here that one of the first things that they did was cancel the $15 increase in 2018. It's true, some of you weren't here, some of us were, and it was painful to watch for certain. So on the education front, I mean, I think the government, you know, has set up this very tension-filled, acrimonious relationship with the entire education sector. And I don't know if you saw some of the feedback following the repealing of Bill 28, but you know, the players, the characters who are trying to negotiate a fair deal for the lowest-paid education workers in the education sector. I don't know if you were out with folks last Friday, or the first Friday actually after we rose, when those CUPE workers walked out. I know that they visited some of the Conservative offices, and they came to my office as well. We called it a supportive rally, and it was really good to talk to some of the caretakers, some of the educational assistants, some of the ECEs, and to talk to most of them were women, Madam Speaker. Most of them had 2 or 3 jobs. They are paid that low. And it was so good to see parents out there on that line supporting them. Once parents found out how little educational assistants were making in our system, they were shocked. Because you can imagine, these conversations don't come up, you know, at a parent-teacher night. But when they did find out how little they made, I mean, one EA told me that what she was making 12 years ago is less than what she's making today due to inflation. And so she has a second job. And, you know, she was out there and really trying to, they didn't even know what was going to happen. Like, it was complete chaos, completely destabilized. This entire sector. And I think that the members who stood in their place on Bill 28 and who supported it. I feel like those words are going to come back to haunt some of these members, Madam Speaker, because, I mean, there had to be an admission at some point that, and the Labour Board was very set to actually rule on this, that it was completely out of order for the government to use the notwithstanding clause during collective bargaining. And it would have been good when our member from Davenport asked the Premier if he would ever use that again. And, of course, we got no answer from him. And he says he actually doesn't regret it, Madam Speaker, creating all that chaos, all that pain, and yet has no regrets. I don't know what that says about the Premier. I just know that he's really adamant about not wearing masks for some reason, even though he says that the medical officer of health is advising that in indoor settings that everyone wear one. And our caucus has them, and I have my mask. And you know, it's not a big deal to wear a mask, Madam Speaker. It's not a lot to ask, really, at the end of the day. The education sector has responded to yesterday's announcement, and I'm connecting this to the fall economic statement because it's the same figure, $32.4 billion base, same as the summer budget. So no recognition, Madam Speaker, that there are increasing healthcare system needs and drivers within that system. This government and this minister seems very happy to dole out $200 at an overall budget cost of $389 million, but not invest that money into more educational assistance, more into child and youth workers in our system. But this is what we're hearing, and this is from CTV Kitchener, just from yesterday. It said that, you know, the region of Waterloo public health officials are echoing the province's messaging around masking, but some local teachers, the people who are actually in the classrooms, in the schools, say the directive doesn't go far enough. And this is a direct quote. They say the number of absences that we're seeing right now is astronomical, and we don't have enough teachers to cover those absences. So the failure to fill in our systems right now is outrageous. So if you go back to what the Financial Accountability Officer said and said, listen, we cannot have a major economic shock in Ontario. Otherwise, that razor's edge that we are on will, in fact, push us over into a recession. So knowing this and knowing all the lessons that we learned during the pandemic, or we thought that we learned, around the importance of paid sick days so that people don't have to go to work sick, around the importance of ventilation, around the importance of public health hygiene measures, all of this knowledge you have at your fingertips because we lived it. And yet here we have a piece of legislation that adds not one new penny to health care. I mean, the entire healthcare sector was shocked at this, I have to say. I mean, they're in crisis right now, so they can't come onto the front lawn of Queen's Park and rally and kick the building as many protesters have done in the past. They can't do that because they are done, Madam Speaker. And they can't afford the time or their energy to fight a government who's so adamant about holding them down to that 1% and around not consulting them. And I go back to process on this. I mean, if the fall economic statement had a fair and open process around consultation, around listening to the people that were elected to serve, if that had happened, then this budget would have additional resources for nurses and for doctors and for hospitals. And you could envelope it, for sure. It would have money for mental health. It would have money for autism, because it makes sense to invest in the people that you serve. It makes sense to actually, adopt an early intervention process. I mean, these are the basic, principles of the social determinants of health. And we called on the government to double the ODSP rates. And I did say in my original comments that there was something good in this fall economic statement. I do try to find some of the goodness in some of the initiatives. But the one encouraging part was the improvement to ODSP, notably tying future increases to inflation. So you understand that inflationary costs matter. Why won't you acknowledge that with the education workers, with the educational assistants, with the ECEs? And so you've said that you're going to tie future increases to inflation, and you're going to increase allowable earnings from $200 a month to $1,000 a month. And however, it does fall very short of doubling the ODSP rates in Ontario Works. And to their credit, the media yesterday asked the minister, the finance minister, they said, literally, like, these are the most vulnerable people in Ontario. The money is there. I mean, the money is, the government says they're going to run a $12.9 billion deficit, but the Financial Accountability Office says you're running a $100 million surplus at the end of this year. And that's without the tax revenue changes from the first quarter finances, which is $5.8 billion. So money is going to come into this place. You've made a decision to put that money down towards debt and not to the pressing issues that are facing, our most vulnerable. And the Minister of Finance can't answer that question. I'll answer that question. I could not live on the rates of ODSP that are offered in this province, not when the average rent in Waterloo is $2,200, which is also not rent controlled. So when the media pushed back and they said, how come you're not addressing the needs of Ontarians in the fall economic statement? Why is this mini budget leaving some of the most vulnerable people out? Not even part of the equation. Really, that you've just said that for those people who are on ODSP who can work, they can actually keep more money. And it did actually, especially last year when the government had given $210 million to businesses that weren't even in Ontario. Do you remember that? Mm-hmm. So $210 million, still a lot of money. It doesn't have a B at the end of it, but it's still a lot of money. And I asked the finance minister at the time, and I said, listen, how come you can go after someone on ODSP who makes, who maybe generates, $225? You claw back that $25, but you're not willing to go after $210 million that went to people who didn't deserve that small business grant. And the answer was kind of, disappointing and shocking. But they said, well, businesses have been through enough. Who goes through a lot every single day is an individual who lives on ODSP in Ontario. Life is not easy for these folks. And, I have one person in my riding, actually, Madam Speaker, who has really, this may not change her mind, but she has said that she's seriously considering medically assisted in dying because the quality of her life is that poor. And this is news. You would have heard this before. There are many people in this province whose day-to-day existence is hellish. And the government has the money to acknowledge that those on ODSP are deserving of additional funding. You're actually acknowledging it in many respects because you're saying, well, you can work more. But there's so many people on ODSP who can't work. It's not an option. And also because discrimination out there is quite real against folks who are on ODSP. I will say something else that's good. The government is addressing the Ontario Guaranteed Annual Income System for 1 year. So this is the GAINS program, and they're providing financial support for low-income seniors who would see their rates increase to $160 per month or $332 per couple. And listen, I've already said, and I'm on the record as saying, seniors using food banks is up to a shocking amount of percentage in Ontario right now. And I know I do hear from them because seniors have certain needs. They like to cook certain meals, and you can't find those meals at the food bank. So, and they're mostly women. I do want to say that as well. Mostly women. Finally, the projections for the education spending remain the same from the 2022 budget. despite what you've heard. However, the spending gap between the FAO's projection and the province's outlook is $400 million in 2022-2023, and this increases to $2 billion. So I go back to the original funding formula for education in Ontario, which has truly never been, I guess, modernized. It's never acknowledged, some of the programs that this ministry has thrown out at the education system, like de-streaming, which de-streaming, in theory, is a great idea, but you have to resource it. You have to fund it so that everybody can be successful. I don't know if the Minister of Education spends a lot of time in the public education system, but in my husband's class, there's 38 students, and the learning levels and the learning gaps that have happened over the last 2.5, 3 years are profound. So there's sometimes 3-4 levels in one classroom. And so you can say everybody's equal, but you actually have to say, but we're going to give you an equal chance of being successful. That's equity, that's right. So to see the education dollars be the same really as the summer budget was pretty disappointing. And I think I want to end really on the housing piece, because a lot has been said about the importance of housing. I think that we actually all agree that the value and the importance and the key factor of shelter in an economy cannot be underestimated. But to see the housing starts really costed out and downgraded already, Madam Speaker, I go back to process. I think that those 444 municipalities that got really shut out of the consultation process, I don't think that can be ignored. And just to go back, so where we are right now, the FAO is forecasting a $100 million surplus this year. That surplus is expected to grow to $8.5 billion in 2027-28. He's actually projecting surpluses for the foreseeable future. The formula that the Financial Accountability Officer uses and the Finance Minister uses, they both consult with various economists, but those formulas are not that different. You look at job creation, you look at revenue through personal tax and corporate tax, and then you look at the expenditures that you've already allocated. And then you have this little thing called the COVID fund, which actually is interesting because it was tucked away in the Ministry of Finance, and then it was sort of scattered out, which I had questions about where it was being scattered out to. But remember that COVID funding was originally, the goal of it was to help the province stabilize, and stability is having a very strong healthcare system with guaranteed resources, which acknowledges the importance of paying people a fair wage, so that you can actually retain them. And this seems to be the piece that the government is not willing to acknowledge, is the importance of retention. And retention is important not only because going through a hiring process and going through another recruitment process is costly and takes time away from patients, from clients, but you actually lose the expertise. And then what does the government do? The government looks at agency nurses, and those agency nurses don't have a connection with the unit. They're dropped into a work environment where they don't have connection, where relationships are not there. All I know is that they're making sometimes double what our nurses are making who are on the regular roster in hospitals. And what is that doing to the entire staffing, human resources issue in our healthcare system? It's drawing people out to work in the private sector, which the government is also funding at twice the rate. Imagine if we had a government in Ontario that was truly committed to public health care. Imagine if when they use the word innovation, that associated, then people would say, oh, when they're talking about innovation, they're actually talking about investing in health care. and ensuring that the people in our system are respected, that the resources are there for children, for seniors in long-term care. Imagine if innovation meant that for this government. It would be incredibly refreshing. So the government, as I mentioned, for the first time in 14 years, in the last quarter, so much money came into this place through high inflationary costs and through tax revenue that we saw for the first time in 14 years a surplus. First time, right? And of course, you remember what was going to happen, and that is that the former government had tied ending the deficit, the operational deficit, to our compensation. And of course, that is no priority that should not be any priority for any of us here in this place, especially given what's happening in Ontario. But that's part of this piece of legislation as well, is that the MPPs won't be seeing any raise or any increase or even a third-party independent review of remuneration. But that didn't stop the government from, 80% of them became parliamentary assistants, which comes with sometimes between 13 and 16%, 16,000 increase. And that didn't stop the government from ensuring that, their caucus was well cared for. And that seems to be the trend, Madam Speaker, is that they like to take care of their people, and we try to remind them that we're elected to take care of Ontarians. Ontario is not Ford Nation. Ontario is Ontario, and we're elected to treat those citizens with respect. So the reason why the fall economic statement, in our opinion, is so irresponsible is that it does not recognize. It's another missed opportunity for this government to acknowledge what's actually happening outside of this pink palace to people in the healthcare system, in the education system. And the move from an environmental perspective around the Greenbelt has really galvanized many people in many rural ridings, because nobody's buying this narrative that, because of immigration, we have to build these mansions out on the Greenbelt. That's a false, it's a misnomer. Yeah. And process matters. Denying us the opportunity as official opposition to do our due diligence through the estimates process is truly something that actually hasn't happened in this place. Like, you're in new uncharted territory, especially, given Bill 28, you're obviously comfortable creating chaos, but we are very determined to ensure that we bring the voices of Ontarians to this place each and every day, and to ensure that your budget and your investments actually match the needs of Ontarians. And don't take the risk, don't gamble with people's health in Ontario. We can't afford another economic downturn. And if you paid attention to what the Financial Accountability Officer had said, is that it's not worth the risk. So let's make sure that that we avoid another economic shock. Let's try to stabilize. I'm not sure if we're even going to get a chance to try to make this piece of legislation better, but we're certainly going to try, Madam Speaker. Thank you for your time and your attention today.